I'm Ami Banerjee. I'm a cardiologist and academic at the Institute of Health Informatics, and I lead the Doctorate as Data Scientist module in the MBBS program at UCL. So clinical guidelines are very much part of evidence-based medicine and evidence-based healthcare. Clinical guidelines are a framework or a set of evidence-based rules, if you like, that we as clinicians follow when we are treating patients, when we're trying to prevent disease, when we're screening for disease, and each recommendation from a guideline is based on a particular piece of evidence which may be strong or weak, and also the level of the recommendation is strong or weak based on what kind of evidence is available. So guidelines are the application of evidence, and they're absolutely crucial to the way that we do healthcare, and they're regularly updated. For example, in my own domain, if you look at the way heart attacks are treated, regularly national and international bodies will reach consensus and update guidelines based on new drugs, new technologies, new ways of thinking. So remember, the learning health system is the idea that guidelines sit in this silo of evidence where people are writing them, but they're actually not getting followed by clinicians on a day-to-day basis, and the people who are doing research are sitting in their silo, and their science is not actually entering healthcare, and the research they're doing is not based on clinical problems. So the idea of the learning health system is that we're connecting up science, evidence and care, and having data flowing between these three silos and connecting them, if you like. And so guidelines, both their application and also how they're put together, can be helped by thinking of them as part of the learning health care system. So electronic health records have been around for at least 2 or 3 decades now at scale, and increasingly we're thinking of how we can be more efficient at using all of this digital information, whether it's in the form of scans, whether it's in the form of blood tests, whether it's in the form of the note I write when I see a patient, and all of that information is there, sitting, but not necessarily related to guidelines. So firstly, electronic health records could be a place where guidelines are put in, so that, for example, every time I see an inpatient, I'm asked, have I thought about giving deep vein thrombosis prophylaxis in the form of low molecular weight heparin? So it's a pop-up, if you like, that's guideline-based recommendations to tell the clinician what to do. That's one way. And also, electronic health records could be used to map how often guidelines are being followed, what the quality of care is that's being delivered, allowing you to monitor both individual care of clinicians, but also at the hospital level or the department level. So I think electronic health records are a massive opportunity in terms of improving the quality of care that we deliver, and that involves incorporating guidelines.